Sometimes you want to slow down time so you can keep looking youthful, young, and fabulous. And that is why we brought back our favorite board-certified plastic surgeon, Dr. Stephen Davis. Hello, doctor. Hello.
Good morning. Wow, what a great transition that was.
Yeah, we're good. We're professionals.
She really nailed it.
We're
Yeah, for a
professionals.
Monday, seamless. How are you?
Good. Nice
Good.
to see you.
So you guys, the number's 888-812-6766. Know that you can call up and ask the doctor, any questions that you have.
Anything.
Any. But I do think it's fascinating. I know we touched upon this last time, but 64% of plastic surgeons reported seeing an increase of millennial-age women seeking treatment. So younger and younger people are wanting to get involved with plastic surgery.
Correct.
When I think about plastic surgery, I do think about like older, like my mom's, aged women getting plastic surgery and getting facelifts and getting tummy tucks and getting boob tubs. But it is, I'm in my 30s, and I am now starting to get to a place where I am interested. My interest is piqued in the idea of plastic surgery. I never thought I would be, and I don't mean to sound insulting, but I was like, I'll never be one of those women. But now I feel like every woman is one of those women.
Maybe we need to get a different name instead of plastic surgery, and it should be something totally different, because what's really happening is it's not so much that people are coming in because they want to get completely changed. It's almost like their thought process is, hey, wait a minute, there's so many cool things that are out there. I can never really age.
Right.
It's almost like it's an anti-aging surgery or non-surgery. You know what I mean?
Right.
It's things that we're doing aren't so much about, changing people to a different person. It's like now if I get this at a really young age, I may never look like my mom or dad.
Right.
That's fascinating. That would be where the fear comes in, even from my perspective. If my wife or someone's like, I'm having plastic, it sounds
like change,
like a big deal.
It is,
and it sounds antiquated in a way.
And let me tell you, that's one of the biggest things that we talk about when we're doing office hours is plastic surgery and relationships, because it's very interesting to see the dynamic of what happens, like who comes in like by themselves.
A lot of times women lie too to their husbands. I mean, my dad, I told you, plastic, he's an eye surgeon, but he also does Botox.
Yeah, you were telling me.
He said a lot of women want to pay with cash because they do not want their husbands to see on the credit card that they had Botox. But the thing is that but the husbands don't notice, which proves what you're saying, which is they're just maintaining and they're trying to turn back the time of aging or trying to not age forward. But there's also something with it too, where the husbands, like, they don't want the husbands to know that they're actually seeking outside help to look so beautiful. It like takes away from their beauty or something. Well, it's so weird, the psychology behind it.
It is, and that's why I always want the female, let's say, if she comes in for the first time consultation, next time around, I always ask them to bring their husbands or their significant other with them, because it is kind of like a joint thing we're talking about, and you don't want to really do this in a vacuum, especially if it turns out to be surgery, because then, you want to have a couple of days to recover, you want to make sure everybody's on board with it. It's not, the same type of thing. But when it comes to Botox and some of the injectable type things, the more natural you can make people look these days, the better job I just did.
Exactly. If you can't notice that I had Botox,
that's it.
A job was well done.
Exactly.
Yep.
That's really what and even lip inject, like when we were talking about lip augmentations, because one of the things we were going to talk about is just things that we could do to still have time to look great this summer, even though it's already this summer.
I feel like summer's over. Once 4th of July hits, summer's over as far as I'm concerned.
The same thing.
And I'm relieved because I want to put jackets back on and I want to wear pants again.
But I have the answer, though.
What?
I have the answer. I can fix these things, and still you can get to the beach and still look great.
So I can get my bikini body now?
Yes.
What can I do?
Okay. I came up with this thing called Flash.
What is it?
It's fat lipo away, same hour. Okay.
What? This sounds like heaven.
I brought props. To show everybody.
Needle?
I bought props.
Okay.
It's not actually a needle.
Oh, what is it?
I'll show you.
Is it a wand?
What I came up with was a way of saying, you know what? If there really is a pocket of fat somewhere, and I'm talking about minimal pockets of fat that you really hate.
Right here.
Bingo.
Armpit, right here.
That's either number 1 or number 2. Number 2.
Can't wear friggin' strapless dresses.
Everybody's listening on the radio, so you can't really show. What do you want to call that?
The chunk muffin near the pit.
The chunk muffin. I like that.
Try not to be so clinical.
It did sound very medical, right?
Yeah.
Be more medical. Yeah, less medical.
Well, you just call it chunk pit.
The chunk pit.
The chunk pit.
So there's one in the front of the armpit, and there's one in the back near the bra line.
There is. I didn't even see that one.
Yeah. So